All right, so we have next a very interesting and relevant conversation on the role of technology companies in combating medical misinformation. I'm delighted to introduce Mr. Sameer Pujari, the unit head for digital country capacity and collaboration at the World Health Organization. Dr. Pujari is joining us from Geneva and he will be moderating the session. Our speakers for this session are Mr. Andrew Patterson. He's the Digital Business Solutions Manager at the World Health Organization. And joining us from Singapore are Ms. Irene J. Liu. Irene is the Asia Pacific lead for Google News Lab, and Irene will be representing Google Search. Ms. Aya Love, she's the Strategic Partner for Development at News APAC. She will be representing Facebook. And Mr. Arjun Narayan, who's the Director, Trust and Safety for the Asia Pacific region at TikTok. The panel will take questions at the end. So if you have any questions, please leave them in the chat box on Hopin and we'll pick them up from there. I would also like to request participants not to live tweet this session. Chatham House rules will apply for this session. So please do not live tweet or attribute quotes to speakers. With that, I now hand it over to Mr. Sameer Pujari to moderate the session. Thank you.
Thank you, Anuja. Good morning, colleagues. Good afternoon, colleagues. I hope you're all doing well. I see there's a great panel that we have here today to discuss this very important issue. Let me start off by an anecdote. I get a message every morning now and then from my mother. Forwarded message comes to me, and she keeps on asking me, I have got this message, weird message, which they say that this is WHO is doing this is about COVID. Is that true? I'm sure everyone gets that. I mean, and being at the epicenter of WHO, I get that message all the time. And that's, I mean, what this topic and discussion is around. I mean, COVID in itself is a massive issue that we've all seen, a pandemic, and the world is facing, and we're all trying to fight that out. But this has also led to this another epidemic, or as we call the infodemic, of misinformation in a big way. And the panel here today will try and discuss how the power of digital can be used to address and tackle this issue where we're getting these questions about incorrect things and causing a lot of anxiety, a lot of mistrust, even in the sometimes, and keeping sort of the right things off the bay for a lot of times. So I think it's an important topic for discussion. We've seen a lot of concerns flying out of here. And today I have great group of people from different sectors who are at the helm of this work and the technology infrastructure that is there. We have Irene from Google Search, we have Arjun from TikTok, and we have Aya from Facebook, and then my dear colleague Andy from WHO, who's been at the epicenter of this work on trying to help and tackle this misinformation through different channels, through power sources, through actual right information. So let me first ask Andy, being in the WHO, I mean, COVID itself is a big situation itself, and then we've been given this additional burden of the infodemic. What and how is WHO managing it, and the colleagues, and how are you doing it right from the center?
Thank you, Sameer. Good morning, good afternoon, good evening, everyone. I think it's an excellent question. It's a problem that we've all faced personally in our personal lives. If you said, Sameer, with the case with your mother, I've had it with my neighbors as well. You know, they all think I'm a medical doctor, which I'm not. I work in technology. Before I start answering that, I just want to re-emphasize that as an organization, our goal is to bring the outbreak to an end as soon as possible and to save lives. Now, I know this sounds obvious, but I think it's important that we state it so that we don't lose focus. We're trying to inform people, we're trying to change behavior so that we save lives. Our mission is to promote health, keep the world safe, and serve the vulnerable. So how do we do this from a misinformation and infodemic point of view? Is again in three kind of buckets. The first is we want to get more health messages to more people through more channels. And with regards to these health messages, we are trying to raise really good content, whether that's WHO's, our partners, or the ministries of health. We want to fight misinformation. And that is one of the biggest challenges we've got now, is that misinformation is spreading faster and quicker than real content, and that's a human nature trait. If you 100 years ago, if you were fishing down at the river and there was a big bear, you went back to your village and said, "Don't go down to the river. There's a big bear." That kind of bad news is spread more quickly because it saves lives. So it's human nature to spread alarming news. Unfortunately, the alarming news we're getting these days is a lot of it is misinformation. So we want to raise good content, at the same time fight misinformation, because misinformation will thrive in a vacuum. So we need to counter that by raising really good content. Another area of work we like to look at with the tech industry especially, is to see if we can get insights into user behavior trends, and also see how we can launch new channels. As a UN agency, we're not at the forefront of technology and what's possible, and so we use the tech industry to gain insights into what is possible and to get those channels launched. So that's our first area of work, is to get more health messages to more people. The second area of work, which I think is super important, is to help fill the gap for overburdened health systems. I'll give you two quick examples here. As COVID arrived in Europe, and on my personal doorstep, we're not far from Italy here, a couple of 100 kilometers, and to get to Milan. So we wanted to help when the Italian outbreaks started in a very serious way. We wanted to somehow help the Italian Ministry of Health. And so what we did is we launched a WhatsApp chatbot in Italian language, and we sent that out so that the Italian government had one less thing to handle. What we've noticed is countries were prepared or not prepared with health messaging. So we filled that gap until they came up to speed. That was another one. The second area is to serve vulnerable populations. For example, where health systems have completely collapsed, like in Yemen. Again, to use the chatbot as an example, 50% of all of our Arabic users were from the Yemen, and that's a disproportionate amount of percentage of users. So the third area of work, so the first area is the health messages. The second is we want to support the ministries of health themselves. And the third area is we want to reach people where they are. I want you all to, you've probably all got a smartphone in your hand. On your average smartphone, you've got about 30 different apps. Actually, on an average day, you use 4 of them, right? In my case, it would be WhatsApp, my Gmail, TikTok, because I've become addicted, and probably my emails. That's how I do it. Maybe LinkedIn. So 4 or 5 apps is what I use every day. And what I want to do is get into the 4 apps that are on your phone without changing your behavior, without dragging you into our channels. So I want you to think back before your lockdown, or maybe now you're all out of lockdown in your country. I hope so. We're in the middle of a second big lockdown here in Europe. 95% of people's journeys to work never changed. You got in the same car, or in my case, on a motorbike. You go to the same roads, to the same car park. You park in the same area. You go in the same door. You go in the same lift, and you go and sit at the same desk. That's your daily journey. The way I look at it is that people have a digital journey, a daily digital journey, and that rarely changes. So we need to get into the 4 apps on your phone. Literally get our content into the palm of your hand when you need it. Back to you, Samir.
Thanks, Andy. Yeah, probably I'm also a Facebook user, so I keep on going into Facebook all the time as well. Irene, I mean, my typical question and our response to my mom is have you Googled it already? I mean, and so obviously the question is going to be from Google's perspective. I mean, it's a very simple method, and that's become a natural life for us, is how is Google helping manage this infodemic? I mean, I see there's a lot of work happening at Google. What's Google Search doing, and the other parts of Google working on and trying to manage this one?
Sure. Well, it's funny because actually when my father and mother send me messages, I say, don't believe anything unless you've seen it from the World Health Organization. That's just kind of my default response to them, But to bring it back to Google, I mean, our mission is to organize the world's information and make it universally accessible and useful. That's the mission from the beginning. And now, of course, in the beginning, it was really Google search. But now the way that people are accessing information from us is in a number of ways, whether you're talking about search, and that could be on your desktop, on your phone, or even through voice, right? Through a Google Home or one of these kinds of audio search devices. It's through Google Maps, whether you're talking about geographic information and looking for where closest places to access healthcare and whatnot, or on YouTube through video, or Google News. So the number of different apps or different ways that you can access information from Google has evolved and grown. And what we've seen now is we have to make sure that on all of these fronts, when someone comes to us and they come searching for information, because that's really what they're doing, we are giving them the highest quality information that we can. And so specifically for COVID-19, one of the things that we really wanted to focus on first was making sure that we were leading people to authoritative information. The challenge that we have is that this pandemic has been ever evolving and changing minute to minute. And I noticed, I listened to one of our panelists from, one of the panelists from yesterday's conference, and they mentioned that, one of the challenges in something that's so dynamic is that you can't wait for academic journals to publish authoritative findings before you decide to act on something, right? You have to, news is breaking every single day from governments, from health authorities, from medical authorities, from scientists, and and so you really have to constantly, kind of balance the need for current, updated information and authoritative information. And I think that one of the things that we've really tried to do as much as possible is to tailor the product. So from a technology standpoint, to make sure that we're connecting the user and their questions with high quality information, and the partnerships that are needed to make sure that those who, such as the World Health Organization and local health authorities, when they have the information at hand, that there's a clear and fast channel to make sure that it appears on our platforms. And I think that is really one of the most important things that we've found through this process, is building those partnerships and ensuring that, as Andy, you mentioned, the World Health Organization is not a technology company, that we can make those processes and pipelines faster and clearer, so that all the great information that is being provided and accessible through organizations such as the World Health Organization, that it's not a technology barrier that's keeping people from accessing that information.
Thank you, Irene. I think that does make a lot of sense. Arjun, the new world of TikTok. I mean, I think is influencing a lot the different genre of people actually. And I think, as I say, what you see is you believe what you see. And so TikTok has become the channel, has given the power of sharing that information and channel the talents across the population, but also the issue of misinformation and how to control that. I mean, I think Google, I understand they're able to manage a lot of these things, but TikTok, it's coming, the content is being generated from the public. How are you guys taking this, and what are the challenges that you're facing, and how are you trying to manage the situation?
Yeah, no, thank you, Samir. First of all, it gives me great pleasure to be here. So actually at TikTok, we're a new age platform. So a big portion of our users is what you call Gen Z users. And a lot of our content is, it goes viral. And so there is a lot of that virality that can be harvested for good. And I'll talk about that in a minute. But taking a step back, at TikTok, we're focused on supporting our users by providing accurate information, resources from public health officials, including WHO. We partnered with the World Health Organization early on, creating an informational page on TikTok and facilitating live streams, right? So the general idea is, like Irene mentioned, there is a general lack of authoritative information. And how do we use the platform as a way to surface relevant information, timely information, and local information? I think that's the most important, because a lot of our TikTok users also come from small towns and cities, and there is a lot of value that we see in surfacing hyperlocal information, which is relevant and fresh. Just in terms of what we've been doing, obviously, I think it's 9 to 10 months now since the pandemic started. We've observed, learned, and adapted. We were probably one of the first few platforms to start, publicly sharing updates around COVID. We also put out a blog in context of how we're looking at misinformation and disinformation campaigns in context of vaccines, in context of some of the stuff that wasn't necessarily accurate. And we've continued to enhance our misinformation policies, and you can see that in chronological order throughout the year. The other piece I think that we've done is, and this goes back to harnessing the power of our community. We were also probably one of the first few platforms to launch misinformation in-app reporting. So if you were to go onto TikTok and you found information or videos or content that you thought was off or wasn't appropriate, we would basically let our users flag that content to us, and we would use that as a way to work with partners like yourself, with independent fact checkers, and find a way to, again, either corroborate that information as being accurate or removing that information off the platform. I think the last piece, which I'm really proud of, is a lot of doctors, a lot of public health officials have actually taken to TikTok in using that platform to help people understand the science behind the virus, in helping people to understand how vaccines really work. And I think and I mean, like I said, TikTok as a platform is all about getting you the reach and making the connections and reducing the barrier to entry. We would like to find ways to continue encouraging this community of first responders, healthcare officials, partners like yourself to continue harnessing the platform.
Thanks, Arjun. That's amazing. I think yes, we will come to this discussion around the positivity and how we can use these channels and platforms for the positive part of it in this stage. Let me go to Aya, Facebook. I mean, everyone gets up in the first cup of coffee in the morning, and you have to open the Facebook and see what's happening around. And I think that's become a big source of information. How are you guys tackling the situation in terms of the misinformation which is spreading, and then controlling that so that we can, it can minimize the impact that's having?
Yeah, so we're looking at it through a few different approaches. One which I work very closely on is our kind of third-party fact-checking partnerships. So, this is a partnership that we've developed. We started about 2 years ago, and we've really kind of developed this kind of program, front end and back end, and seen how effective it can be when we see kind of misinformation spread across borders, and the same kind of misinformation. So, sorry, just to backtrack a bit, fact-checking program is we partner with third-party fact checkers who kind of independently fact check content on our Facebook platform as well as Instagram, and now we have about over 80 partners globally, and kind of focus on the partnerships within Asia Pacific. So partnerships like that have been a huge part in looking at information, and once they fact check content, they're able to reduce it on the platform, which means its visibility is much less. At the same time, if users do come across information, they're given a link that they can click through to kind of understand why this content has been fact checked, and that debunks that piece of content. So that's one big part in partnerships. We also work a lot with organizations like WHO and as government organizations such as Singapore government to launch chatbots and to kind of provide a platform where we can publish verifiable information for users to go to. So we have the Coronavirus Information Center where users can click on to get the kind of most recent updates, and it's localized depending on where you're clicking from. And we also believe in kind of, you spoke about your mother getting this information and checking the truthfulness of it or verification. If people have interacted with content that has then been fact checked or removed, we actually alert users to a link that they can then follow to get this kind of verified information. So they then understand that content that they maybe have believed in the past has now been verified, and they have the kind of source of that. Our policy team has been working a lot to kind of, we spoke about how misinformation is shifting during COVID. So our policy teams have been kind of expanding their misinfo and harm policies. So we've been practically removing content that violates, that could, that shows fake cures or shows fake numbers, so people are not misled. And we've also kind of looked at ways that we can support the ecosystem. So this is in providing grants to our fact checkers and to other communities, and also a fellowship, a health misinfo fellowship, which we've launched, which is a year-long fellowship to allow our fact checkers to kind of really deep dive and learn more about misinfo, health misinfo, which is really kind of a specialty within the kind of fact checking realm.
Thanks, Aya. I think it's a lot of great effort and a lot of learnings going in there in the process. I've just been also following the questions from the audience here, and maybe Aya, a question for you. I mean, you mentioned already that you're pointing your the audience or the users to the right information. One of the audience members has mentioned that Twitter has recently started tagging accounts of governments and public funded entities to confirm that. Are you guys thinking about that? I mean, is that being help? Would that be helpful to tag the right authorities to flag this information, and is it worthwhile for doing that? Because it seems that that question is coming out, and maybe I think it's a good point out there.
Yeah, so we actually we provide information about different accounts. I mean, different accounts that people could, so they understand, you know, how they're funded, if they're state-owned or if they're publicly funded. So people have that information there. In terms of, you know, pushing forward accounts that have verified information, we rely on kind of verified information from government bodies, as well as WHO, that supply information to our COVID information center. So that will be kind of the one-stop shop where people could go to get content that they can, you know is verified, and have that as kind of a source of truth.
Great, thanks, Aya. I think this brings up the question of governance, and that's the center of all these issues. I mean, I think working together, there's a big challenge of the governance, whether it's internal or external. WHO, I mean, for us, digital health is a key area. We've just, through our countries and member states, cleared a global strategy on digital health, and governance is one of the key strategic objectives at that part. So I want to discuss with your thought processes. Let me start with Andy again. Andy, I mean, the governance issue, working with the private sector, public sector, but also working with the governments. I mean, where do you see that the factors, whether it's mostly external facing governance issues or internal and external, and how can these be handled and managed in terms of being prepared for a pandemic, but also trying to prepare yourself while the pandemic is happening?
Yeah, it's an excellent question, Samir. I think the first thing to note is that WHO has not always been able to work with the private sector, and that's important to underline because, you know, our governing bodies is basically the countries. So we're governed and working with the countries rather than the private sector. And there's always been this, you know, this cloud over the possibility that the private sector could influence an organization like ours. So this is fairly new to the organization to be able to, you know, in the last 4 or 5 years, to be able to embrace the work with the public and private partnerships. I think WHO is best served when we talk about the problem definition. So we come and say, what are we trying to achieve? And we don't really look at the solution definition. We leave that to the tech industry to come up with the solution definition. And usually what happens is if WHO was to paint the picture of the problem, the tech industry has a whole bunch of solutions, and where they overlap is a sweet spot. And that's where we can start doing projects very quickly. One of my lessons I've learned in this whole year and during this pandemic is launch quickly and iterate often. Find the lowest common denominator that will allow you to launch from both from WHO's point of view and our technology partner. And treat them as partners, not as service providers, because we're all in this together. We would literally cannot do this without the technology companies. Can you imagine if we didn't have these partnerships with Google to be able to get our search results and good health content surfaced to 80-90% of the people who are searching for information? This is so key to us like this. I think the other thing that we can work with in the private sector is the different layers of trust people have. They trust their government a certain amount, depending which country. They trust their news agency perhaps a little bit more, again, depending on the country. They trust their family a little bit more, again, depending on the family. Some, might not. You always have a weird uncle somewhere, right? And then what they have at the top, influencers. People are listening to their influencers. So what Arjun was talking about on TikTok, we have to also forge these partnerships with people who are very big influencers. And there's some great epidemiologists on TikTok who can summarize things in 30 seconds, which WHO, has to publish, a 5-page PDF about. So it's simplifying our messages. And I think that's a really important aspect of our work. So with our role, with working with them from a governance point of view to sort of how do we work with digital companies is, we're trying to curate content, as Irene was saying about Google search, raise good content, fight misinformation. But we also have to think about it on a global level and a local level. We want the user to have the best possible experience. So if you do go to Google search and you use COVID or coronavirus or 30 related terms, you will get an experience which has been developed by working with Google search team to say, okay, this is the important things to raise. This is how we've got to raise it. And this is our problem. And they come up with the solution, which is, this excellent sort of knowledge panel, live knowledge panel, which is based on your geolocation. So we will serve a global level symptoms prevention, some statistics. They will serve some news from credible agencies, global health advice, but local health advice too. What Aya mentioned from Facebook, some of the policy work, I think, is super important. It's a really slow burner, changing policies and making policies more robust. And with the Facebook policy team, we sit down with them twice a week and talk about the changes in the guidance. As one of the panel members was saying earlier, this is a constantly changing environment we're in. So we have to be constantly talking to our partners and saying, hey, the new mask guidance is coming out, or we've got guidance for masks for children coming out. How do we surface this? People are talking now with the holiday seasons coming up in the US and the holiday seasons coming out in a lot of the world with Christmas and New Year's and the Chinese New Year, talking about holidays and family gatherings, small mass gatherings. How do we get that content out to them? So we do a lot of work with policy teams to make them more robust. YouTube have basically expanded their harm policy to say if it goes against public health advice from WHO or the CDC, we're taking the content off. That's because we're sitting down with policy teams and working with them. You mentioned, I'll just quickly mention some of the work we do with countries. Some of the difficulties we have is building trust within governments that it's okay for us to work with these technology companies. Because in the case of Italy, we are building a platform in Italian. And the Italian government will contact us and say, well, wait a minute, you're not using our guidance, you're using your guidance. And ours is slightly different. You've put, stay 2 meters apart from somebody, and we're putting at least 1 meter. So could you change your content? And we have to sort of say, well, no, this is an Italian language bot, which the population of Italy will benefit from, but it's not a Ministry of Health bot for Italy, the country. And of course, in a lot of cases, I would say in 90% of cases, these products, the user is going to be better served if they're run by their local Ministry of Health themselves. But of course, in a lot of cases, they don't have the technology or the manpower or the content to do that. So we have to fill that gap and bring them up to speed. And that's a big challenge, is showing the worth of digital interventions on large populations and convincing. Public health hasn't changed in 70 years. And we're revolutionizing the way we're doing public health. It's the democratization of public health messaging is what we're doing now. And behavior change is difficult. So those are the big policy things from my side.
Thanks, Andy. I think you bring up some very good points. Public health hasn't changed for the last 70 years, but the way it has been managed now with digital health is impacting. And I think the partnerships and collaborations are key to that piece of work, but I think the governance has to be prepared for that. How do you see this coming out? As you see, working as it is with the different governments is not an easy part, but through the global channel, and then how does the governance impact you, whether it's internal, because also there's an internal governance structure which needs change during these kind of pandemics, as well as the external facing, and sitting with competitors, sitting with all the different areas. How do you guys manage the governance issues, and what do you see the main challenges are?
So I would say that we too are constantly trying to balance the needs for the user locally with all the different factors that come in. And so we partner with government, we partner with international organizations and experts. And really the way that we tailor our solutions is really with the user in mind, right? Because what is so important is that, as Andy mentioned, there are many layers of trust, and depending on where you are and who you are, you may stack rank who you trust more in different places. And so we want to acknowledge that, but we recognize that you can't do this work, especially when you're talking about a global health pandemic, without engaging with local governments, local ministries of health, and also just the information ecosystem, right? So I mentioned the work that Facebook is doing with fact checkers. We also work very closely with news organizations and fact checking communities to ensure that whatever users are getting is high quality, but also locally relevant. And so, I will admit that there is no one solution that we have that's templated across the world. We have, from a governance standpoint, from a product standpoint, yes, we are building products that are meant to cater to a global audience and to work globally. But when it comes to the partnerships and the kind of information we highlight, Andy mentioned the COVID-19 page. So if you search on Google search a number of different terms related to COVID-19, coronavirus, and other search terms, it will take you at the top to an offering an information panel that really is curated, in partnership with the World Health Organization to provide that kind of highly authoritative universal information in a number of languages for our users. If you go to YouTube, we feature, if you search coronavirus or COVID-19 on YouTube, you will actually see info boxes that can link to the World Health Organization as well as local government health ministries, because we want to make sure that there is that balance between authoritative information that is global as well as local. And so I think that is kind of how we approach the work, with the user in mind. And this is also how I personally, in the work that I do, approach partnerships, because we know that, journalism and news and fact checking, these fact checkers and journalists are on the front lines. They're on the front lines on the street to see what is happening to communities. They're on the front lines interviewing government officials and healthcare workers to really identify what are the needs and what are the challenges. And also, they're the ones who are going to be probably the first to report when there are lockdowns or regulation changes or other things that actually really affect the daily lives of of users, of individuals, citizens who are just trying to live their lives and cope. And so it's really important for us that we are able to make sure that we're engaging on all those different levels, but really at the core with the user in mind.
Thanks, Irene. I think it's important. Yes, we have to realize that there are challenges, and I think there are strong arguments against each of these issues, and I think we've got some good lessons learned from what you guys are doing. Arjun, I mean, how does it work in terms of governance for you guys, and also the pressure? I mean, one of the questions that comes from the audience is also the corporate pressure, because it's not going to be easy internally to manage these kind of reactions to the pandemics. How do you manage the governance structures internally to tackle that pressure from the corporate internal peers as well, to keep going and fighting this misinformation?
Yeah, I think, Samir, for us, we have a huge responsibility to our users, right? And our users are global, and our users go beyond the tier 1 cities, if you will, right? So we're not just a platform for the elite or the, if I may use the word, the scientific cabal, right? We go to the small towns, and like I said, we're proud about it, and there is immense power to it. We have perhaps the reach that a lot of partners can benefit from. So just calling out a few points from our perspective. Just like Irene mentioned, we partner with partners like WHO, but we also partner with individual governments and the government health agencies. So, for example, in case of India, we've partnered with the Ministry of Health and Family Welfare, right? Now, in some cases, and of course, these are all partnerships. So, the idea is to see if we can promote local information and relevant information to the population. So that's that. The other piece for us, of course, is how do you get the freshest information in front of our users, right? And it's actually, let me put it this way, one of our big challenges with, especially with medical misinformation is there is a lot of latency to good information coming to the fore. The other piece, of course, is and please don't mind me stereotyping it. Academics and doctors are academics and doctors, right? So how do you find a way to bridge the gap between academic research and how do you translate that in a way that users are able to consume that in a way that they're used to consuming on TikTok, right? And I actually one of the examples I wanted to cite, and Andy inspired me. We have a group called the Guides. This is based out of the UK. They're called Team Halo. This is a group of doctors and clinicians. I don't know how to say that word, but basically, some of the videos are really, really interesting because you basically have doctors and academics who take to TikTok, and they are relaying information in a truly TikToky way, right? It's very funny, it's humorous, and I quote. And one of the doctors have said, people come for entertainment, but they get hooked onto science. And that for us is really interesting. How do you translate, real world authentic information in a way that Gen Z consumes it? And once you have these young people consuming that information, there's a domino effect because they go and educate their families, right? And so for us, that's where our focus has been, right? How do we partner with likes of yourself, likes of Andy, basically experts, and how do we translate that in a way that our users are able to register the correct information, and then how do we use that power of virality to spread good? I did want to talk about the latency piece very quickly, and I'm going to give the floor back to you. We partner with a lot of fact-checking agencies. But when it comes to medical information, when it comes to the latest and the best information, there is latency. There is latency for multiple reasons. One, there are very few fact checkers who are in this niche space, right? I mean, you get a lot of fact checkers fact checking general misinformation. But when it comes to medical misinformation, all roads lead to WHO, and then there is the whole aspect of dealing with multiple countries, right? I mean, every country has its own validation process, and you have different sources of truth. So for me, I'm actually looking to see how can we solve that problem. Because like you said, misinformation spreads in a vacuum. By the time we get the correct information to the user, misinformation would have gone viral. Right. So I think that's the problem we're looking to solve for, and very open to ideas from all of you, and in fact our audience, to see how we can solve for that constructively and collectively.
Amazing points, Arjun. I think two great points you brought. One is the positive influencers point that you mentioned. We have to use these channels to spread information, and I want to get to that point in a bit in the second round. But do you think we need more stronger regulations here? Do we need more stronger actions or control over these things to try and control the misinformation? And how does that block to what Arjun is saying? How can we use these platforms for bettering health information spread? There's obviously the one common keyword that has come out is partnerships. And how do you see, the partnerships helping bring the positive of this health outcome? Two, whether we need more stronger control and regulations across the board, or is that a hindrance in moving and controlling this process faster? And how can we use this technology, the platforms you have, for bettering the health outcomes in general, not just minimizing the impact of misinformation?
Yeah, so I think that's it's a huge question, and definitely kind of a lot to unpack. And I think Andy did a good job at really kind of looking at the different ways. We talked about partnerships. You've got those different layers of trust within, you've got non-government organizations, government organizations, news publishers, fact checkers. So it's really kind of promoting the credible information that they're able to offer on the platform, using the various product levers that Facebook does have. But it's also building trust, and building trust is very important. So that's, a big part of that is promoting transparency. So, offering more information about who these organizations are, and what they do and where they're from. As well as kind of having more informed, promoting good quality journalism, good quality, credible information, such as fact checks from our fact checking partners, and also, implementing these, these informed treatments that allow kind of users to understand what they're reading and give them that ability to kind of decide. And we've seen some of these products be very useful. I can speak mostly to fact checking because that's where I work very closely, but the Inform products that we have, we've seen that when they come across this kind of pop-up that says this has been fact checked, this is why it's wrong, 95% of the time they won't click through to the misinformation, and they'll just click through to the article. They'll either click through to the article or they'll choose not to interact with it. So I think, building trust and working with these partnerships, I think, very vital in working and dealing with the spread of misinformation.
Thanks, Aya. But in terms of taking it beyond, do you think there are possibilities and opportunities, and how's the appetite within Facebook to use the platforms to better health outcomes? We have seen that there is, by giving the right information, people are learning that. Is there a way and channel that can be sort of further leveraged to provide better healthcare services, not just for pandemic, but in general, to make better health outcomes?
Would this be, sorry, I wanted to make sure I get it right. So this would be in terms of the partnerships that we'd have, or working with other outlets such as WHO on the platform? Absolutely, yeah. Yeah, I think there's a lot of great opportunity. This is something that kind of took everyone by surprise. As a company, everyone kind of also experienced a huge pivot. We lost a lot of, our content reviewers had to suddenly, as we closed our offices, had to work from different locations. So we really had to kind of prioritize and shift in the way that we tried to kind of develop these tools. And I think this really is only the beginning. And I spoke about these fellowships that we've offered and grants that we've offered that kind of look towards the future and kind of developing the next generation of fact checkers, or developing this expertise in medical misinfo, which is something that fact checkers didn't really think about before. They kind of had this general, approach to misinfo. So thinking of ways to kind of, really invest in the ecosystem and really develop these partnerships, and work with them. And also, constant, Andy spoke about constant iteration. I think that's really important for, any future development of these partnerships.
Thanks. No, I mean, that's great points. And I think we are very proud of having worked with Facebook in several. I'm personally been involved in doing several programs in terms of tobacco, helping people quit tobacco, whether it's in Philippines or the blood donation drive in several parts of Asia. So I think there's a lot of potential, as you mentioned. I think I'm just calling on all the audience also to leverage these channels. I think the same question goes to you as well. In terms of Google, and I think we've done a lot of work. Andy has worked very closely with Google. We've done in different segments of Google. What is the appetite in-house? The partnerships, I've seen there's a lot of trust and sort of intent from Google. How are you guys thinking from within the organization in terms of leveraging these partnerships or taking it further to make a better world tomorrow?
Sure. We've, since COVID-19, we've really tried to ramp up as much as possible the partnerships specifically focused on addressing the pandemic in front of us. So we've invested more than $6.5 million to the fact-checking community alone, is specifically related to COVID-19 and ensuring that these, the folks who are in the field, who are doing the hard work, have the support that they need at this time. And part of that is also the organizations that support the ecosystem. So, for example, the International Fact-Checking Network, as well as an organization called First Draft, which is really in the business of essentially upskilling and training and creating standards for the fact-checking community to be that watchdog, to have their kind of pulse on what's happening around the world and be able to communicate that to various audiences. So, investments in partnerships is one piece. Our products are really also focused on this. And I think what's interesting to me is, I also come from a journalistic background. So I think of information in sort of, news articles, text and photos, and maybe video sometimes. But one of the increasingly how people interact with healthcare, health outcomes is also just in the daily acts of their lives, right? So it's how easily can I find out where I can get a test? What clinics are open if I'm starting to feel unwell? At what point should I schedule an appointment at a hospital, or should I, make a phone call and do telemedicine, right? And also, is there a lockdown in my neighborhood? What's happening, right? And so, like I said, we're on the number of product fronts that we work on, including maps, which you wouldn't necessarily think of as directly related to health. We're trying to make sure that there are opportunities to really provide information that can better outcomes in the moment and also in the long term. One other thing that we haven't really talked about, which was actually discussed in the previous panel, is the importance of media literacy and news literacy. And I think that, as we move out of, we're 9 months into the pandemic, we start thinking about, okay, I think hopefully people understand more about the disease and the way it spreads now than they did previously, as we move into a world where perhaps there are going to be vaccines and other interventions. How do we make sure that individuals are getting information, that we are able to actually think ahead and preempt and work on building that resistance to the next wave of the infodemic that we know is coming, which is going to be related to vaccines, treatments, and other policies related to containing the pandemic.
Thanks, Harry. I'm learning so much already. And Arjun, you mentioned in the same lines the guide that these guys are doing. And that's exciting. I didn't know about this. So I'm going to look them up. But I mean, can we not use this kind of mechanism in a more systematic way to better health outcomes? I mean, what are you guys thinking? And even in general, this will give you much more visibility and much more audience and do a better good for the world. What are you guys thinking around this from a strategy perspective?
Yeah, I think, Samir, first things first, we're very, very open to partnering with authentic and credible partners. We're also very open, and not to belabor the point that Irene mentioned, I think it's also important to invest in the ecosystem because it's a very fledgling ecosystem, especially in the misinformation fact-checking space. So we're doing our bit in terms of research investments. We're doing our bit in terms of finding authentic partners. In fact, we would be very, very open to recommendations from you or Andy, right? We're a tech platform, right? And so for us, we know what works best for us is if you give us a piece of content which is authentic and credible, we'll find a way to reach, to get you the reach and get it to people when they need that information. And so it's a very complementary and symbiotic relationship. And we want health organizations, first responders, everybody else to come to the platform and partner with us and work with us, and we'd be very open to it. I just want to make one last point. I know we're running out of time. I think, if anything, one thing that the pandemic or infodemic has taught us is we're just at the start of the journey. If anything, this space is going to grow. And I think it requires commitment, it requires investment, and it requires eyes on the ball. Maybe a vaccine will come out in 2 months. Everything will not go back to normal. I mean, this is just the start. And so for us, it's about how do we think about things like misconceptions, which is one end of the spectrum, right? To the other end of the spectrum, which is all about how do you solve for misinformation? How do you help people understand? I mean, there's a lot of chatter around vaccine hesitancy, right? There's a lot of social media reinforcement around, people not understanding the science behind vaccines. So how do you then educate people? How do you educate your common user in a way that they're more responsible and responsive? So yeah, that's my final and limited point. Back to you.
Thank you, Arjun. No, great points. I think you've said it rightly. It's just the beginning, and I think we all realize that. And it's the beginning of a great start. I mean, I think we have a way forward. You guys have done an amazing job in using and delivering these platforms for several things, and I think we can leverage that platform to better health outcomes. Andy, I mean, how do you see going forward? I mean, post-COVID era. COVID is, it's not that it's over. It's just, we're starting to respond to it. We're seeing some actions, but it's a long way still.
Yeah,
In
I think
the next immediate future and post-COVID era, how do you see
yeah.
these partnerships helping?
Yeah, thanks. I think Arjun made a great point with regards to, this is only beginning, and if there are some positives to come out of COVID-19 would be, on a public health level, that this has acted as a massive catalyst to address a lot of problems we have with misinformation, which have been boiling up on small local levels over the last 10 years. I mean, just a year ago, almost to the date, we were talking about misinformation spreading through Samoa about measles, and 300 people have died because of that misinformation. And this is the kind of stuff we have to address. So the next big battleground is definitely going to be, we're 100% COVID now, 100%, and we have to be. It's the biggest health problem, in our lifetimes. So, as Arjun said, the next big battlefield is vaccines, and we need to tackle that and vaccine hesitancy. But also, we need to harness the power of the tech industry to get the logistics of vaccine access to medicines. In Europe and in North America, they're talking about, is the vaccine safe? In a lot of other countries, it's how can I get the vaccine, and how are we going to get, vials of vaccine and syringes into villages in Malawi? It's a logistical nightmare. But fortunately, the tech industry have also some of the best logisticians in the world, with the likes of Amazon and FedEx and TNT and these kind of companies, to get things from one place to another. So in the immediate thing, we still have to keep tackling this. What Irene was saying, what we're doing now is 100% COVID. What I would like to see in the future is, how do we take this to the post-COVID era? So everything we're doing at WHO, we're setting the foundations for the future. COVID is a communicable disease, which means it goes from one person to another, and it's causing a lot of deaths. At the end of the day, still 70 to 80% of us will die from non-communicable diseases like cancers and diabetes and things like that. So how do we transfer all this excellent energy and work we've done in COVID era to make it the new normal? The second and final point I want to make is that when I use an analogy in the real world, when I travel, I don't want to take the fastest way to get me to a place. I want to take the fastest way to get me to a place safely. And this is my big message to the tech industry, is we may have to start looking at algorithms and reduce the speed to ensure safety. And for me, it's a tricky one. We have to do a better job at stopping misinformation rising than at the moment. What we're doing is doing a great job at bringing misinformation down. So I think we need to also shift the paradigm of our work and make sure that all this excellent work that we're doing. On a personal level, just as a sidebar, there was one question about influencers spreading misinformation. If one thing positive comes out of COVID is that we value our doctors and nurses more, and our football players and our entertainment industry a little bit less, I think that would be fantastic. But that's my own personal opinion. Over to you, Samir.
Thank you so much, Annie, and thanks everyone for this amazing panel. I'm going to summarize the discussions in 3 points and leave for the audience here. Clearly the one word which is spoken most of is the partnerships. I think the intention is there. We are all fighting a global evil that is beyond mankind, and I think we have to learn that each one of us can do something on this work, whether it's you're part of a tech industry, whether you're part of a broader governance agency or an individual startup company. I think we all can do it together. But remember, the power of togetherness is much more stronger than doing things on your own. And so let's come together, let's join hands and use that. And not only for COVID, of course, COVID is the immediate problem, but health in general can be improved much better through these platforms and technologies. So we count on every one of you in the panels. Thank you so much. In the audience, thanks for your questions. I've tried to interweave them within my questions to the panelists, but I've learned immensely lot. One of the best Saturday mornings in Geneva I've spent for a long time. So I'm looking forward to taking this work forward in collaborations together. Thank you so much, everyone, and have a lovely weekend. Bye-bye.
Thank you.
Thank you. Goodbye.
Thanks.